Liposuction is one of the most common body contouring procedures in the world. It comes in the top 3 procedures that I perform at Dr. Karishma Aesthetic Clinic. But there are a lot of misconceptions about this surgery. So today, let's clear them up for you. No, liposuction is not a weight loss surgery. Bariatric surgery is a weight loss surgery. Liposuction only helps to remove stubborn pockets of fat from various areas in the body. The fat which comes out is in the liquid form. It is hollow, it cannot be weighed. Your weight loss will only happen with a good lifestyle, nutrition, and an exercise routine. Remember, liposuction works best for those people who are close to their ideal weight and are looking to just take away certain areas of fat. So there are certain safety limits for fat removal. By the International Society of Plastic Surgeons, there is a limit of 4.5 to 5 liters which has been mentioned. At my clinic, I believe in following the regulations. Removing fat beyond these limits can cause more complications, and also there are chances of irregularities and problems in the final results. Your recovery will tend to be slower if large volumes of fat is removed at one go. And there are always complications, especially when a patient is diabetic, hypertensive, have other comorbid issues or medical issues. And to combine that with a very large volume of liposuction, absolutely not. So liposuction should be restricted to about 5 to 6 liters at the max. Liposuction not only removes fat but also tightens the skin. In certain scenarios where your skin is extremely loose, like in the lower part of the belly, sometimes in the inner thigh region or in the arm region, the liposuction will give you fat removal as well as a certain amount of skin tightening. But if the laxity and the elasticity of the skin is completely gone, then we have to combine certain skin removal procedures in addition to the liposuction. And these procedures are usually called as a tucking procedure. It could be a tummy tuck, it could be an arm tuck, it could be a thigh lift. And post-bariatric surgery, when people use massive amounts of weight, we usually see these conditions where there is stubborn fat, but there's also a lot of laxity in many areas, and we need to combine liposuction with skin removal. But at the end of the day, I need to see you and customize the procedure and decide what suits you best. Liposuction done in any area of the body has a very similar recovery process. In the first 4 to 5 days, you will experience some discomfort. Pain is obviously going to be there. I tell all my patients that please expect some amount of pain in the first 48 to 72 hours. So I tell them to just have a little bit of patience. We do a lot of ice compresses. We make them walk. But a little bit of pain is always expected, which starts subsiding after day 3, day 4. Swelling and bruising. These are the normal body response to any surgery, and especially liposuction when we are performing the procedure underneath your skin. So the skin is what is going to swell up, it's going to bruise up. It takes about a few weeks for it to settle, and we provide you the necessary medications and topical creams which will help to reduce this swelling and bruising. The most important aspects of a liposuction recovery is wearing your compression garments, and secondly, doing the lymphatic massages as advised by our physiotherapist. This will start for you usually by day 6 to 7, and you will continue to do your daily massages up to 2 to 3 months, and same hold goods for your compression garments. Let it be a small area like a double chin or a large area like the abdomen or thighs. Your compression garments would be worn for at least 2 to 3 months. And this also depends upon your skin laxity. If you have too much of lax skin, I may make you wear it even beyond sometimes 3 months for a few hours. But if you have a very good skin tone, you're going to see your results within about 6 to 8 weeks, and maybe we stop making you wear your compression garments after that. Liposuction is a permanent method of fat removal. All of us are born with a set number of fat cells when we are born. With the process of liposuction, I am permanently removing these fat cells from that area of the body. Remember, when I remove the fat from an area of the body, I do remove about 80 to 90%, but there is about 10 to 20% of fat I do leave behind under the skin. Of course, for the skin to have its blood supply and to survive. Now the 10-20% of fat which is left behind, it cannot multiply. However, if all the fat cells get exhausted in other areas, the remaining fat cells in the area that lipo has been done can enlarge. So fat cells can enlarge or can shrink in size if you gain or lose weight respectively. Maintaining a stable weight will achieve long-term results. Liposuction sculpts, but the results come with the right expectations. If you would like to know more about liposuction, do visit us at Dr. Karishma Aesthetics. If you like this video, please do click on the like button below, subscribe to our channel to watch more such informative videos.